me go ahead and introduce myself. Okay, guys, good day, everyone. We're a little bit late. We have some technical difficulties. However, here we are. We're going to start. I am Marcia Gordon, founder and CEO of Marcia's Healthcare Registry. We are located in Broward and Palm Beach. We are a staffing company, and we do hire HHA, CNA, LPNs, and RNs. We are Medicaid certified, and we accept Humana, Florida Community Care, Sunshine Health, etc. If you are a HHA and you're looking for work, a nurse, you can always give us a call. You can come in and put an application in any of our locations. If you have a loved one that you need some help with at home, you can reach out to us. We will send a certified nurse to take care of your loved one wherever they are. Hospital, nursing home, at home. It doesn't matter. We are here to help you. Today is Health and Wellness Thursday, and of course we have our own doctor, my friend, Dr. Karen Lewis. And today we're talking about MS. All right, so I will share just a few myths about MS. MS is a death sentence. What do you think? Put it in the chat. You think because you have MS, which is muscular sclerosis? I hope I'm saying that right. I'm going to let the doctor give us the facts. So I'll probably just share 3 of them. MS only affects older adults. Another one is people with MS are unable to work or have a normal life. What do you think? All right, at this time, let me bring on Dr. Karen. She will be on the phone with me. Go ahead, Karen.
Okay. Good afternoon, everyone. Can you hear me?
Good afternoon. Yes, ma'am.
Okay, so this morning we're talking about multiple sclerosis, otherwise called MS. So what is multiple sclerosis? Multiple sclerosis basically is an autoimmune disorder.
Okay.
Right? And autoimmune meaning that it is immunologically based, and it's when auto means my immune system attacks my body. So there are a number of other autoimmune disorders like lupus, which is an autoimmune disorder. But with multiple sclerosis, what happens is that you're damaging the myelin sheath. And the myelin sheath, hold on a second, please.
Just a few minutes, guys.
Cells, that's the covering of your brain and spinal cord nerves.
Okay.
So what it does, it affects the covering of the nerves. And because it affects the covering of the nerve, what happens is that the damage interferes with the signals that the nerve sends throughout your body. So you can perform functions like vision, sensation, and movements. Understand that?
Yes. Okay.
But because the nerves are affected, you're not getting that signal. So your body, you can't send the message to say you need to see, or you need to feel, or you need to move.
Okay.
That's why it affects different aspects of your body, like your sensation, your eyes, and your movement. Okay?
Okay.
So what happens in multiple sclerosis? What happens in multiple sclerosis? The symptoms, because of these damage to the nerves, to the myelin sheath, that's the covering of the nerves, you can get problems with your vision. So you can get double vision, you can get vision loss. You can actually have muscle weakness, which can affect one side of your face or your body or below your waist. So you notice that there are people with multiple sclerosis who are bound to a wheelchair because they can't walk,
Right.
because of the weakness in their lower body, and sometimes they get abnormal sensation or numbness, and this can affect your face or your body or below your waist, that's your lower limbs. Okay, so that's why you have the symptoms of multiple sclerosis, where you get fatigue. They tend to be a little clumsy, so they will drop things, or they will lose their balance and fall. So you would think that they're clumsy because they're not coordinating their motion, movement, and their sensation. And remember, if you have problems with your vision, then you're at risk for falls. You're a little bit more clumsy, you're not seeing where you're going. So you have problems with your eyes, problems with your sensation, and problems with your motor function, which is your movement. And that is why you would think that they're a little clumsy, or you'll normally be able to do things, and then you notice that, I'm not doing what I would normally do.
Right.
They sometimes get dizziness, or they can get problems with their bladder. Okay? And as I always say about your clumsiness, where you have loss of balance and coordination. Another thing that can affect is your memory, is your cognitive function, where you have problems with your thinking, your memory, your concentration. Okay, and you can get mood changes, and then muscle stiffness or spasm in the lower limbs. Okay, now you don't get all these symptoms at once. So today you might be a little clumsy and falling. Next week you might say, geez, I can't remember things. Oh, I can't concentrate on this. This is just too much for me. Or you might just say, oh gosh, I'm so fatigued. I don't want to get out of bed. I don't want to move. Or you might have problems with your mood. You're just cranky all the time. So you have interchanging. Not all of them are occurring at the same time. Okay? And there are days when you probably have problems with walking, and there are days it's not so bad. And then this is it, because this can be because of the type of multiple sclerosis you have, because there are a few types of multiple sclerosis. Okay? And this is basically academic, but there are different types of multiple sclerosis. Okay? Now, multiple sclerosis tend to occur in younger persons. Okay? It tends to occur in persons who are between the ages of 20 and 40. It rarely occurs in children. So early onset adulthood is when MS occurs. And it is 2 to 3 times more common in women. So it's more common in women, and also people of Northern European descent. So blacks and Asians are less likely to have it. Not that they do have it, but they are less likely to have multiple sclerosis. Okay? So multiple sclerosis tend to occur in more Northern European descent, or if you have a family history of multiple sclerosis. But it can occur in just about any population. I know that they're seeing a lot more younger people with multiple sclerosis, or a lot more black with multiple sclerosis. So it's probably a little bit more common than people thought it was before, because they're seeing a lot more black people with multiple sclerosis. Okay, so it's not something that usually happens or is very common in blacks and Hispanic, but as I say, because of the increase in number, it's I'm not sure why, but if you have an infection called Epstein-Barr mononucleosis, that's a virus that causes infectious mononucleosis, and we normally usually call that the kissing disease. You're at risk for getting.
I had asked to one of the myths, MS is a death sentence.
So it's not a death sentence,
Right.
but we'll talk about it in a little while. Okay, so multiple sclerosis tend to be more common in temperate areas. For example, northern United States and Canada, Europe, and lower levels of vitamin D is linked to greater risk of multiple sclerosis. So if you are at risk for multiple sclerosis and you're not exposed to vitamin D, you're always locked up inside. That's why it's always good to go outside and get sun, guys.
Yes.
And you're at risk. And people who are obese or had obesity in childhood tend to have risk, or people who have other autoimmune disorders, as I said before. Your thyroid disease, your type 1 diabetes, or other conditions at risk. And people who smoke have a greater risk. Okay? And also, what they find out is that people with multiple sclerosis have a particular gut microbiome. That means that the organisms, let's say the bacteria that you have, or the gut organisms, is different in people with multiple sclerosis. But I'm not sure what's happening. It's just some things that they find here. Okay, so what are the complications of multiple sclerosis? I spoke about some of them before. You have difficulty walking, and that's because of affecting the nerves. So you have difficulty walking without assistance. You can lose your bowel or bladder control. There could be memory loss. You can have sexual dysfunction, depression, and anxiety. So multiple sclerosis is one of those things that's not a death sentence. And right now, people can live to, desired age. Usually, they say multiple sclerosis takes about 10 years of your life expectancy. But with treatment, this might not be affected. Okay, so it's not a death sentence. You can live. It's not going to stop you from breathing. It's just going to be a debilitating disorder where you have to get assistance with many things, but it will not kill you. It's not a fatal.
Great. People with MS are unable to work or have a non-normal life. That's not true.
Right, because as I say, you can remit, you can go into remission where you can actually go through a normal day. Yes, you might get, you might have some relapse, but you can go through with, as I say, and even with treatment, no, it's getting much better. People probably forget that they have multiple sclerosis until they have a relapse. They totally forget.
Wow. Nice. Okay.
So, basically, how is it managed? There's medication to help to treat it. There is physical, occupational, or speech therapy, depends on what is affected. And of course, you get mental health counseling, because it can lead to depression. It can lead to when you're being diagnosed with something that you say, oh my God, and especially a lot of people are not going to be able to walk, I'm going to lose my independence. Yes, it can be very jarring for a lot of people. But the thing about it is that we need to be able to know that if we have that diagnosis, support is available. But we don't know how to prevent it, but we know that in order to lower your risk of the flare-ups, there's some things that you can do. Apart from taking your medication, a healthy lifestyle is very important, okay? So there are choices that you can make that can slow the decrease disease progression. So, help you to stay eating a nutritious meal, getting enough sleep, do not smoke. So these are some of the things. Remember your vitamin D exposure, going out in the sunlight, managing your stress. These are all the things, and every time we talk about, we go back to the same fundamental principles of how to deal with illnesses. So, as I say, multiple sclerosis is one of those conditions that nobody wants to get that diagnosis. It can be a challenging condition to manage and to diagnose, but the thing about it is that even though there's no cure, right, you can still have a fulfilling and active life, and support is always available, and there's treatment there that can help you to maximize your potential in terms of your life and what you want to do. Okay, but remember, if you have symptoms where you're feeling overly sensitive to heat because of your sensation is off, if you're feeling unsteady, if you're having problems remembering things, if you have numbness or tingling in your arms and your legs, problem with your vision, or weakness in your arms and your legs, you should always go to your doctor and bring those symptoms with you. Your doctor will ask what's happening, tell them what's happening, and they may be able to diagnose. It doesn't necessarily mean that it's multiple sclerosis, but it's probably something that you may want to look at and probably another diagnosis. But what you need to do is to know your body, know what is happening, know what's happening with you. When there are changes, you will know, and you'll be able to start treatment early if there's a problem, and probably avoid another condition that might be worse. So what you need to do is always knowing your body, because early diagnosis sometimes can lead to complete cure if there's a cure available.
Great. That's it?
Yep.
Yeah. Thank you so much for sharing those information with us. I will share a quote. The key to a healthy life is having a healthy mind. Always remember to drink your water, exercise, and of course, every week, Doc always say the same thing. It's about our lifestyle. So thank you everyone for joining our lives today. And do follow us on Facebook, IG, YouTube. And remember, have a wonderful day. God bless. And I'll see you guys next Thursday with another topic. Bye for now. Bye, Doc. Bye-bye, Facebook. Thanks, guys, for hanging out with us today. Thanks so much. Bye-bye for now.